Here's a bold truth to start. Limiting how often your child eats nuts because they contain fat might actually be doing more harm than good. But here's where it gets controversial. Despite nuts being packed with fat, not all fats are harmful. And avoiding them out of fear could mean missing out on vital nutrition for your little one. Mentioning kids and nuts often triggers a strong reaction from parents, almost like I uttered a forbidden word. This is largely because nuts get tangled up with two scary ideas, fat and allergies, which make many parents hesitate before including them in their children's diet. Some parents worry that nuts will cause their children to gain unwanted weight or, even worse, trigger serious allergic reactions. However, the truth is quite the opposite. Nuts are not only safe when introduced properly, but also extremely beneficial for children's health. Let's unpack the fat factor first. Years of low-fat diet marketing campaigns have convinced many parents that all fats are bad. In reality, nuts contain a type of fat that's actually good for kids, unsaturated fat. This healthy fat supports the proper functioning of the heart and digestive system and helps reduce inflammation, which is linked to many chronic diseases. Imagine nuts as a natural source that nourishes growing bodies with these essential fats. Beyond healthy fats, nuts are nutritional powerhouses that supply children with critical components needed for their development. They include omega-3 fatty acids, important for brain, nerve, and vision growth, especially in younger children. Nuts are among the richest dietary sources of polyphenols. These antioxidants play a fascinating role in protecting the body, and they even reduce cancer risk. Fiber and protein in nuts contribute to slow digestion, meaning kids feel full longer, which can help prevent constant snacking on less nutritious foods. Interestingly, studies reveal that about 20% of the energy in nuts isn't fully absorbed by the body. But this partial absorption still leaves kids feeling satisfied. Furthermore, the fiber content also aids in keeping children's digestive systems running smoothly, promoting regular and comfortable bowel movements. When it comes to managing weight, nuts might surprise you. Research shows that including more nuts in the diet is linked to a lower risk of children becoming overweight, thanks to their satiating effect and nutrient density. So, far from being fattening treats, nuts can support a healthy weight. Now, let's talk about allergies, the concern that dominates many parents' minds. Nut allergies have become increasingly common, understandably raising alarm. But here's the twist. Introducing nuts to children at the right age and in appropriate forms can actually help reduce the chance they'll develop allergies. Studies support this approach, even for kids at high risk due to family history. One notable study found that regularly feeding peanuts to infants significantly lowered peanut allergy rates in adolescents by 71%. The secret is early introduction, ideally between 4 and 6 months, using safe forms like 100% nut butters to avoid choking hazards. The best way to start is by applying a tiny amount of smooth peanut butter to the inside of your child's lip and watching for any reaction over 30 minutes. If there's no problem, the amount can be gradually increased, always with careful monitoring. These small steps help build tolerance safely. Of course, if your family has a history of allergies, it's smart to consult your doctor before introducing nuts. And if your child does have a reaction, mild or moderate cases can often be managed with antihistamines. But serious allergic reactions require immediate emergency treatment with an EpiPen and an ambulance call. So what's the takeaway? Allowing children to enjoy nuts regularly, nature's nutrient-dense treats, helps steer them away from unhealthy processed snack options that offer little nutritional value. Kids are naturally good at balancing their calorie intake throughout the day, so there's no strong need to limit nuts for fear of overeating. Once your child is old enough to safely chew whole nuts, usually between 3 and 5 years, offering a generous handful daily is a great way to boost their nutrition. For younger kids, nuts should be introduced in paste form or ground finely and mixed into other foods to eliminate choking risks. Interestingly, most adults avoid nuts due to worries about their high energy content and potential weight gain. But extensive research debunks this myth, showing that even relatively large daily servings of nuts, up to 100 grams, are associated with modest reductions in body weight and fat. Despite this evidence, current Australian dietary guidelines still recommend limiting nut intake for children and adolescents, which doesn't fully reflect the latest science. This is a point worth debating. Should these guidelines change to better promote nuts as a healthy dietary staple? To help your child enjoy nuts, offer a variety from different nut families to keep their taste buds interested and to broaden their nutrient intake. Opt for raw or dry roasted, unsalted nuts to avoid unnecessary added oils and salt. Remember, if your child refuses nuts at first, don't give up. It often takes 8 to 10 tries before a child accepts a new food. Start with milder nuts like cashews, almonds, or peanuts. They tend to be softer and sweeter, which little ones often prefer. Then, you can gradually introduce stronger flavored varieties such as walnuts, pecans, or Brazil nuts. Mixing these into dishes or baked goods to soften their robust taste and texture. For parents looking for inspiration, nutrition expert Nick Fuller, author of Healthy Parents, Healthy Kids, offers practical recipes like easy granola and tahini nut bars to help incorporate nuts into family meals in a delicious and accessible way. So what do you think? Should we rethink the routine exclusion of nuts from children's diets? Are the fears around fat and allergies overblown? Or do they deserve the caution they get? Share your thoughts and experiences. Your voice could help other parents make informed choices in this often misunderstood area.